Good morning, and thank you for joining me, Sangha, and my fantastic co host, Morten Matheson. Today we have with us Karolina, CEO Care Workers Charity. Karolina, welcome.
Oh, good morning. Thank you for having me.
Morning, Karolina. Really good to see you again. When I first met you, what I really enjoyed and liked about you, and I still do, is your ability to always say what you see and do things that you think are right for care workers and care professionals all over the country. Are you still that person, or has the political glory of your work now changed who you are?
I don't know of any political glory in the first place. and I definitely try to stay true to that. I think the most important thing for the Care Workers Charity is to support care workers, to champion care workers, to show the society and politicians how important care workers are. And we're very much true to that. We are able to also offer care workers financial support, which on one hand is terrifying because, you'd think that people whose job is to support lives of others wouldn't need financial support. They'd be paid well enough not to need that. On the other hand, it is great that we can do that and actually support care workers in need.
Indeed. Right now in Denmark, it's election time. So I'm paying a lot of attention to what the political parties are saying about just that situation, actually. And not surprisingly, the party that I'm voting for is very focused on just salary for the care sector in general and for the healthcare sector also. How are you seeing this changing now in the UK? Can you look towards better times, or are you thinking we're still in a pickle with this?
We need to hope that hopefully very soon the government will finally realize and recognize how important social care is. That social care isn't just a secondary Cinderella service to the NHS to support the NHS, but a very important sector and service in its own right. That they will realize that lives of people who draw on social care are as important as everybody else's lives. Therefore, lives and well-being and pay of care workers is also hugely important. So yes, we need to hope. In the meantime, we need to carry on with all the lobbying that as a sector we're doing, with pushing for the right policy changes and the right investment in social care. And we have to keep reminding people that social care is a place where money brings around great outcomes rather than a place where, money just gets wasted. And I think that's very important as well.
What are you seeing as the biggest challenge that our care workers are facing currently? Is it with regards to the financial? Is it regarding the move towards more digitization in the sector and skill upliftment? Is it more in terms of recognition, or is it a combination of all?
I think care workers in majority welcome the move towards more general digitization, because it gives them more time to have face-to-face contact with people. And that's what care workers always want. As much time as possible, actually doing the job, actually supporting people, rather than hours and hours of filling in paperwork. So that is definitely welcomed, although I imagine for some it is a challenge. And we need to make sure that the right training is in place for those who need it. In terms of pay and struggles, yes, that goes together with another thing. So we have burnout from COVID, and then on top of that, you're putting huge stress of the cost of living crisis, and people just can't cope. They can't cope with the mental health and anxiety and stress that all of those things together create in their lives. And they also can't cope financially, covering even the basic things that they need to pay the bills, to pay for food, to buy clothes for the children. And for somebody who's working full time, I think that's an unacceptable situation to be in. So it's definitely a huge struggle. The struggle for recognition has always been there. I don't think it's gotten any worse with COVID, but unfortunately, I don't really think it's gotten better. There was time where I was hopeful in the first lockdown that I thought maybe people will give more recognition and respect to social care. And that lasted a little bit, but I think in general we're still very negative in terms of the society around what social care is and what it does, and recognizing that. So yes, I'd say two main challenges are the pay, working conditions, disparity from the health sector, and then the lack of recognition that care workers deserve.
You'd really think, wouldn't you, that in any other markets, job markets, when there's a lack of a resource, which we can certainly say that with the workforce crisis that there is in care, that then price would go up on what you can deliver. And as a care worker, it would be fair to expect that my services, my skills are now in a higher need of, or society is in a higher need of it. Now I could expect a better treatment, a better recognition, and then also a better pay. Why is this not coming together?
I think it's so all comes down to the lack of understanding or willingness to understand from the side of the government, because if the levels of funding are not changing, and they're really not, extra 500 million here and there is really not going to make a huge difference, if any difference at all, for the entire workforce. And then when you have the Secretary of State talking about bringing in volunteers to fill in the gaps, undermining the importance of the work that care workers do, skills and expertise required, I think together that really shows that the understanding still isn't there, which means the funding isn't following through. And it is the government funding that in many ways sets rates for everybody else, because of how funding models work. So yes, and unfortunately, well, I think as a sector we need to do more, and we've been doing a lot, but I think we need to do more and find a different way to explain in a way that can be rejected how important, how vital what we do is, and not just in relation to NHS hospital discharges or prevention of NHS admissions, in relation to supporting people to live the lives they want to live, supporting people to be happy, rather than, like I say, just being a job that I think in minds of our ministers is a job that just anybody can do, which couldn't be further from the truth.
Coming back to skills, Carolina, you mentioned that, of course, government is trying to push for more volunteers into the sector, which obviously doesn't help us in the right way, as in giving the right credit to the work that is already happening. But skills is also a hugely important aspect of the sector, because care needs a different kind of mindset, different kind of skills. So are you seeing that generally there is a change and professionalization that is required in the sector, or even giving it the recognition that this requires a degree of professional skill, rather than saying it's no no entry challenges or no bar to entry into the sector?
First of all, it requires the right values that we don't necessarily value as a society, skills that we undermine by calling them soft skills. We're talking, about your empathy, compassion, care, and kindness, being adaptive. So those are very important skills that not just anybody has, and can support people that way. Then the workforce is already professional in a way that it already needs and has a lot of skills, including a vast variety of clinical skills to support people. And again, that's not recognized, but it was my personal experience when I was a care worker that very often, I was doing activities that 2 or 3 years before that you'd only experience a district nurse doing. Supporting people with their stomach bags, catheters, vents, cancer medication, peg feeds. So, like I say, a lot of quite complex clinical skills. Somehow what keeps happening is that an expectation is put on social care workers, on care workers, to take on more and more responsibility. It was the same case during COVID, when GPs, nurses, physios weren't going out to the services because we're all in lockdown. Care workers had to do all of those roles. And that doesn't seem to be followed up, either with funding or with recognition or with certifications. And And that's very difficult. I think partly it's taking advantage of good nature of care workers, where everybody knows that care workers will just do whatever it takes, whatever's needed to give people the best care they can within the limitations of their role. And sometimes I think it's just, purely taking advantage because people know care workers will anyway, so why bother putting extra funding in place, which is terrifying and incredibly unfair. So, yes, I think the workforce is already highly skilled and professional. What it needs is for that to be confirmed in some way. I've always been a big champion of care worker registration and a professional body for care workers. I think a care worker needs a place to belong, a place where they feel they can go for advice, where they can go for support, where they experience abuse, and many care workers do, for a place that will hold them accountable. Because we do in individual organizations, but I think something bigger would really help, would help care workers feel that they are on par with your physios, occupational therapists, nurses, which they should be and are. Care workers are definitely at the same level of responsibility, if sometimes not higher, than many of those recognized professionals. You go into somebody's home every day, or you live in somebody's home. You are the sole person responsible for their life and well-being. And
Absolutely.
somehow that doesn't seem to be recognized as worthy being invested in more by the government, as worthy being recognized more by, like you say, some sort of professional registration or a professional body that applies to everybody.
How come, really? I don't understand. We can all see, at least here in this room, all the advantages of such a register. But what are the downsides? Why isn't this just simply carried out?
Barriers that are always mentioned are as a barrier to entry, where people will be put off that they have to register, especially existing workforce, people that are very experienced, because you'd need some level of either qualification or competence. I'm a fan of competency-based assessment rather than tick box exercise, do this test. So that's a worry. Obviously, who's going to fund it and who's going to pay for it? Because it would be quite an expensive activity. And then I think excluding people who may have the right values, but maybe don't necessarily want to follow a certain path. I think all of those can be easily addressed. We can definitely we should be looking at a very flexible entry point where you can submit different levels of evidence, different kinds of evidence to show your competence. I think it is good for people to know that not just anybody can join. And I think it can be done sensitively in a way that wouldn't put people off who have never worked in social care. And I think as for paying of it, it needs to be perceived as an investment, because outcomes of that, could be far greater than any money spent. To have workforce that feels they're invested in, they have a career progression, which will attract more younger people to come into the sector, which will help people stay. Even if to some people it seems risky, I think it's definitely a risk worth taking. I don't consider it risky at all. I consider it a necessity and something that we really owe to care workers by now.
Absolutely, and the merits are huge. We spend a lot of money in training and retraining our workforce every year. Sometimes unnecessarily, that's what I think, because we are just repeating the training without actually ensuring whether it's adding on to their competency or it's a tick box exercise. And those all could be avoided with such kind of initiative, where that someone is already competent and you can share that competency across multiple care providers even. So you can definitely invest from your training budget, I would say, to fund this initiative.
Yeah, and like you say, there's a lot of time and resource wasted on repeating things that we should be building on rather than mindlessly repeating them, just to be able to say that this training was done again. When I moved to London a few years back and I registered with different home care agencies. I did moving and handling training 5 times in the space of 2 weeks. And it was the same thing over and over again. It's such a waste of my time and such a waste of providers' resources to put into me. So yes, I think it's necessary that we try to move on from this mindless repetition and actually invest in people learning more.
Coming into the digital space, because obviously this is also what interests Sangha and myself. Not too long ago, when it was the Professional Care Workers Week, I was hosting a panel for the charity, and I was grilling some of my colleagues from the suppliers catalog in the sector. And a question I asked them was about the workforce or the work environment. And I'm interested in are you experiencing any of the people that you support coming back to you saying where digital has not been supportive, not been putting enough emphasis on the work that people are carrying out, and instead become a barrier to doing what they're wanting to do? Because obviously Sangha and we want a story in this world about where it's a positive and it's an enabler, but we never get to that unless we also address some of where digital is actually a burden and a barrier. Do you come across any things?
In the charity's work, not that I can think of, because people are very much focused on their financial and mental health well-being. But we do monitor a lot of online forums. So I think, first of all, people are excited about digital because, like I say, they know it can cut down times they have to fill in paperwork, and that's always a good thing. That can help with how they deliver care and making sure that people get the support that they need. I think where potential stresses come in is if a care worker in an organization is told at very short notice something's going to be introduced, they don't feel ready for that. There are very quick turnaround times. I've worked with some care workers in the past who are home care workers, where they found certain pieces of digital software very stressful because you had to do something at exactly the right time. Otherwise, it would mark it as not completed or a mistake, where obviously we need to be a bit more flexible in care environments. But no, in majority, I think people definitely find different systems helpful. They want to be transparent, and digital definitely helps with that. They want to be able to search things quickly, which again, that's very helpful for. But like I mentioned already, most of all, they just want to spend as much time as possible face to face with people. So wherever that can be improved on, that's always something incredibly positive.
I'm glad that you say this. Another thing that I find recently with a lot of the newer systems out there that has to do with how the workforce administrates itself or is being administered. I think that you can actually play a larger role, also booking my own shifts, changing with other people, and putting some power back into the hands of the workforce rather than always being done to and you're being done with. It's another thing that I think is a trend, not just in, of course, in our sector, but also in hospitality and other places. You see this, which is also, I think, it's a sign of us valuing others, that we can actually say, well, you're grown-ups. Of course, you can handle this yourself. You're not being locked down into minutes. On this minute 1, you're doing this. Minute 7, you have to be there and you have to do exactly this. And if the person you're supporting has another opinion, you still have to do what's in your books. So I'm glad that you see the same thing, because obviously I was thinking if there would be a place to go to share bad stories, would also be with you. So I'm glad that you have this general feeling towards digital.
Yeah, definitely.
Yeah, and I think, transparency, empowerment, giving time back, these are some of the key things that technology provides. And I always believe that even though, there are lots of anecdotes that a particular segment of the workforce will leave if we digitize, but I have hardly seen that, from the sector. They're more welcoming of technology as well as data, because they know that it's going to change
Well,
their.
absolutely. I was talking to an operations director from a relatively large home care provider who was saying how they had rolled out a digital system. And the way he described how they'd done that was impeccable, because they'd taken everybody out and asked them the question, how do you feel about this? Are you scared, or are you worried about feeling left behind, or that you, yeah. And just that thing about being included and asked the question made them also address the right issues in their own organization. And obviously, he said he was quite surprised with how many people were worried in one or another kind, but they'd been able to address them, and they'd made them into champions rather than obviously just leaving them for themselves. So I think implementation training is an important part of this, and not just how to, but also why, and also
Exactly.
leaving room for all the worries that isn't necessarily directly on how to do things, but why are we doing this? Are we being monitored indirectly, and all of these things that at least some years back were also parts of Sequoia's implementations, that we were addressing this. But I agree with you, Karolina. Today, most will have heard of others that have worked with, or perhaps in previous roles, worked with the system. So it's really positive to see that, and to hear the word transparency used here, because a lot of what's going on in care is being picked on because of lack of transparency. But
yeah, and I think the most important thing is that organizations take everybody with them. Nobody's left behind feeling that they can't do it, because digital should help and should be seen as a solution rather than yet another source of anxiety for people, because what care workers don't need is definitely, more stress. So as long as that's at the forefront of mind for people, who deliver it, organizations who decide to put digital in, and obviously that now there is a ministerial order, we have to introduce digital to every organization. Yes, that's the most important thing, making sure everybody is included and everybody at the end of it is happy with using a system, and that the system is helpful to them. It doesn't become a hindrance.
Very well said there.
I think that's a really good place to end our conversation today. Thank you very much for joining our podcast, and thank you for all the work that you're doing to promote the recognition of care workers.
Thank you very much for having me.
Thank you, Karolina. Take care.
Thanks a lot. Thanks. Bye.
Thank you for listening. Don't forget to subscribe, review, and share your favorite Take Care podcast with your friends and colleagues. Until we meet next week, take care.